Hi Sam.
Hello, Tiff. How are you? You okay?
I am good. I'm very busy.
Busy.
Yeah, about to fly away for a month.
Yes.
But everyone, welcome to episode 8 of Sam and Tiff Talk Science.
Prolific.
It's 8, isn't it?
I've no idea.
Okay,
Prolific.
I hope it's 8. I'm Tiffany, one of your co-hosts, and I'm a scientist entrepreneur. After my PhD in oncology at University of Oxford, I've now jumped into the biotech startup world where I'm a scientist at Infinite Hope's Cancer Vaccines, a spin-out from the university. And I've also co-founded my own startup called Gambit Bio, where we're using saliva for early cancer detection.
Awesome. Very impressive. And I was on your website this week and I tried to buy a kit.
You were.
I tried to buy a kit and almost did it.
And you got blocked.
I was like, oh my God, I'm going to buy 25 pounds.
That's because the product doesn't exist yet. We're still in the middle of making
That's
it.
That's exciting though, that you have, right? That's.
I'll put you on the beta tester.
Please do. I want to test it. I want to do it. I'm Sam. Sam, I'm a doctor and a scientist, and I do some other things as well. But Tiff, you're going away.
And we both met at Oxford.
Oh, we met at Oxford.
Yeah, just to drop the Oxford oncology name. Yeah.
We did our PhDs together in Oxford, just over there.
Yeah, where this is being filmed.
It's not very far away from here.
But yeah, I am going away.
Where are you going?
Oh my gosh. Just realized all the places begin with a B. I'm going to Baltimore for a mass spec conference.
Very nice.
And then I'm going to Boston for a few conferences and some meetings for the businesses, and then Bali for a friend's wedding.
Wow.
Yeah, and then China, and then back here. So I won't see you for a month now.
So business and leisure, right?
Yes, both combined. Maximum efficiency.
Yeah. And the business stuff, can you tell us roughly?
Yeah, so we're just closing some fundraising rounds for my company. So just dropping by some existing investors and potential investors. And conferences in science.
That's exciting, right? I haven't been to a conference in ages. I would love to see. Is mass spec?
Yeah, so there's the ASMS, American Society for Mass Spec. That's the biggest mass spec one in the world, I believe.
Wow.
And then in Boston, there's bio and dark genome. Bio is more of a business partnering one. And dark genome sounds really sexy, right?
Wow.
It's all about the non-coding space, non-coding RNA space, DNA space.
Interesting. You told me about that before, I think, because you said about something about. I remember you said something about that before, and about how it's a cancer vaccine. Am I allowed to say that?
Oh yeah, lots of immuno-oncology people, and
so is it because there are like neoantigens expressed by the dark proteome?
Yeah,
is that what's going on?
Yeah, that's what people are looking into right now.
Why the dark proteome? Why don't we just focus on the regular proteome? The regular genome.
Because it may be more tumor specific.
Oh really?
Yeah, than regular proteins.
Oh, I see. So
it's a really good potential target, because it might be because, as you know, the non-coding space is more about the regulatory aspect of neoantigens. So that might be more specific to tumor pathways. But that's just one of the many
interesting
targets you can look at.
Because it's more kind of messed up in cancers, and normal cells don't worry about it too much.
Yeah, exactly. Whereas a lot of tumor-associated antigens, they're still expressed in normal tissues, just at a lower level. So they're not as specific.
Interesting. Okay, cool. That sounds very cool.
Yeah, sorry, that was a distraction.
No, interesting. Okay, what are we talking about?
So today we're going to talk about our top 3 favorite deals in the biotech world from May 2025.
Exciting.
This first one, we were both customers of, actually.
Unfortunately.
I don't regret my decision. So this is about the famous 23andMe.
Yes.
Yeah.
So tell us, go on. What happened?
So 23andMe, the iconic consumer genetic testing company, is unfortunately going bankrupt. And Regeneron is about to buy it out of bankruptcy for a measly $256 million US. And I say measly because at its highest valuation, 23andMe was trading at $6 valuation of $6 billion US. So it's dropped quite a bit since then, since their IPO in 2021.
And it got super popular at one point, right? So you were a customer.
Yeah. So as background, I was at UC Berkeley for my undergrad and master's, and we were interested in all things, Silicon Valley made. And obviously, we had to do a 23andMe test. So it was a spit test. It tells you about your ancestry using your DNA, but also health risks and interesting facts about, like, are you likely to like caffeine? For me, yes.
That's in there, the caffeine one. That's hilarious.
The caffeine.
Is it
and
right? What did it say about you? So you,
I think it got mine not correct. It says like less likely to consume caffeine.
oh,
Yeah, so they got that one, but it got the other thing right.
That's probably why they went bankrupt.
It's statistics, not cause and effect.
That's true. That's true.
But they did get some of this stuff right.
Did they? Okay.
It got less likely to fear public speaking, which is correct.
To fear.
To less likely to speak. Yeah, less likely to fear public speaking.
That's genetically inherited? That's genetically encoded?
Apparently. Well, they found, so these are like associations. Sorry, a little bit of a rabbit hole, but they look at these SNPs, or single nucleotide polymorphisms, basically like small variants in your DNA that correlate with different traits. So, for example, we look at the same spot in the genome between you and me, and if Sam has an A in that spot,
curly hair.
Yeah, and I have a G, then
straight hair.
Yeah, something like that, as an example.
Yes.
But they do it with traits that are like really quirky and interesting, like less likely to be bitten by mosquitoes, or more likely to be a light sleeper. Yeah.
Interesting.
Yes.
Okay.
But yeah, this company was founded by Anne Wojcicki, can't say her name, in 2005, 2006. And they got the first FDA approval for a consumer-based genetic test to give out health information to the consumers directly. And in 2021, they went IPO in collaboration with the Virgin Group. And they were doing really well. And then suddenly, recently, their stock price has tanked quite a bit and they've gone bankrupt, unfortunately.
Yeah.
So, which is why the court proceedings are ongoing right now for Regeneron to buy them out.
And they never were able to make a profit, right? They were never profitable?
I don't think so, not to my knowledge.
So, from a business point of view, maybe like as a business person, right? So you're trying to sell this kit. It's a one-off. You're selling it one-off. How do you make it profitable?
Exactly. You don't even need to be like a super businessy person to see that this business model is not too profitable.
Yeah.
Because like this is your DNA. It stays unchanged.
It doesn't. That's the whole point, right? That's it.
Yeah.
You're born with it. You die with it. That's it.
So if you're a consumer, you only do it once in your life. You don't need to keep doing a spit test again and again. So that was one of the weaknesses of the business model. And they tried to circumvent that by saying if you subscribe to their platform, then you get new information. So these new associations between the SNPs
as new
and
things are
genetic
discovered.
Traits. Exactly. They'll be like, hey, we found something new, but you have to like pay a monthly subscription.
Why was that not successful? That sounds like a good idea, no?
Yeah, unfortunately, it wasn't enough to
convince people.
Yeah, for them to break even. And I think it's because they got distracted by another goal. So the CEO wanted this to become a drug development company as well. Yeah. So basically like find potential new targets for drugs by using, SNPs and asking people to complete these surveys. Yes. But as you and I both know, drug development, very capital intensive, and it cannot, like in my opinion, it probably can't be funded by the profits from these consumer test kits.
Yeah. Interesting. So you think they kind of got a bit distracted by that new goal?
Yeah.
Which coincidentally is where this is headed in any case, right? With Regeneron buying it up.
Exactly. I think Regeneron was probably buying most of their data up. Yeah. And just to say, in 2018, 23andMe did have a deal with GSK for drug development. GSK gave them like $300 or $400 million to develop drugs together. But that's coming to an end as well.
Was that successful for anything?
Not that I know of. But they were trying to go down that route. And the CEO did say, oh, they should have split the consumer arm and the drug development arm. But it's a bit too late now.
Okay. Interesting. Anything else on that one?
Yeah. I guess we'll just have to see. We'll just have to see how it goes with the court proceedings. But it goes to show you can have like a really cool idea, but when you don't have a business model to back up your tech, then your company can come crumbling down. But it's also because of I would say it's because of the financial markets as well. Because obviously recently, like funding has dried up and interest rates have gone up. So it's hard for 23andMe, no matter how big their network is, to find the right funding to keep on going.
So, but I guess so. Regeneron is going to buy their data, right?
Yeah.
And the really exciting thing about the genetic data is the drug development. I know that maybe they were going a bit distracted, like we said, but the exciting thing about it is the drug development. So there's this awesome stat which I love, which I always say, which is that if a new drug, is supported by genetic evidence, then it's about 3 times as likely to get approved. So what does that mean? I'll just give one example. A good example is PCSK9. Have you heard of PCSK9?
I think you mentioned this to me last time.
It's a cholesterol regulator. So in the population, there are a subset of people who have a small change in the PCSK9 gene, which means it's less active. And in those people, there's less cholesterol, there's less risk of heart attacks, and there's less risk of strokes, suggesting that if you inhibit PCSK9 with a drug, then you can reduce cholesterol, reduce heart attacks, reduce stroke. And indeed, there are really good FDA-approved and emerging drugs which inhibit PCSK9 and do all of those things.
That's beautiful.
Built exactly on the genetic evidence. And that's, I assume, what Regeneron are going to do.
Yeah, that's what Anne wanted to do, but now she can give it to Regeneron to do the exact same thing.
So you look for associations in the population between a specific gene and a trait. So I think one of the most... So cholesterol is an awesome one. But what about like cancer, for example, right? So we don't have any drugs, I think it would be fair to say, that stop people getting cancer. Well, maybe there's one or two. But so imagine if you look in the genetics, right, and you find a gene whose mutation, whose allele change is associated with a reduced risk of cancer. And then Regeneron say, okay, look at this gene, let's hit it with an inhibitor. And they find that it reduces the risk of cancer. That's a possibility from the data set.
That would be amazing. I can think of negative regulators of P53. Like those genes would be a great potential target.
That's true. Yeah,
that's true.
That's true. I guess, yeah. But so that's the kind of thing that Regeneron are going to shoot for, is using the genetics to build drugs.
And just to say, I think 23andMe will still go on with its consumer testing, because once Regeneron has bought them up, maybe I think they're aiming to finalize the deal by Q3 2025. Then that's exactly what they're going to do. They're going to continue the consumer arm because there's still business in that side, and that's where the data is coming from, the scraping of the data.
Yeah.
But they'll start, finding the targets they can develop drugs for.
Exactly.
Yeah.
Super exciting.
But yeah, obviously it's been a very tumultuous journey for 23andMe with like the struggles to get the FDA approval, which they achieved in 2015. And obviously with privacy issues with the leaking of their customers' data. So that is all being ironed out right now in the courts.
Leaking of the customer's data.
Yeah.
Yikes.
Yeah, guys, do your 2-factor authentication.
Indeed. That's scary, right?
Yeah.
One other thing about this is the other potential for it is with something like screening or diagnosis. So genetics is extremely important to determine your risk of disease. So I'll give you an example. Example about prostate cancer. So there was a trial recently. They looked at patients who had a high genetic risk of prostate cancer.
Mm-hmm.
So they looked at the patients who had the top 10% of genetic risk based on SNPs, by the way. So based on data like
so
this.
Not on like DNA repair genes or stuff like that.
Purely based on SNP risk. So exactly the kind of data that 23andMe are using.
Yeah.
The top 10%, if you only screen the top 10% genetic risk, it's a much better test for prostate cancer than what we use at the moment, which is the things like PSA and MRI.
Wow.
So
are you talking about the barcode 1 study? Or am I thinking of something else?
maybe. What's that? What's the barcode 1?
They were doing a saliva DNA test of men at a certain age where they have a higher risk for prostate cancer. And I looked at the mutations, and it turned out if you look at the mutations, it becomes a much more accurate way of detecting prostate cancer with an MRI follow-up compared to PSA alone.
Sorry.
Don't worry.
I can't find it. Barcode 1. I'm talking about barcode 1. Yes, I am.
You are talking about
Yes, I'm
barcode
talking
1.
about
There you
barcode
go.
1.
Oh, I had no idea it was SNPs. I thought it was mutations in known like DNA repair genes and stuff.
It's SNPs. Yeah. So
Didn't know that.
So, but that could be commercialized too. But it's not just prostate cancer, right? It's any type of cancer. It's also things like heart attacks, strokes, things that we worry about. All of that is controlled by the genetics, by the SNPs. So these guys now have an awesome database to look at exactly that.
Yeah, and then that's why like when I bought this kit in Berkeley many years ago, I really admired the company's mission because that was what they were going for. Alongside the for fun ancestry stuff and fun traits, and also people finding lost family members. By the way, that's also a huge part of the
That's
company.
wild, right?
Yeah, there are lots of like stories in the press about how they found their long lost cousin or sibling or parent. It's really cool. But yeah, aside from that, like I think this mission of trying to find these associations and targets, so it's what really excited me as a science undergrad back then to do this test.
Yeah.
Yeah.
What's your take on the barcode 1?
I think it's very smart.
Yeah.
And I would say what we're doing at my company, Gambit Bio, it's very similar. But ours is more of a real-time detection tool, whereas this just helps you stratify the patients better.
Yeah.
But obviously it's not for real-time detection. It just tells you the risk, lifetime risk that you're born with.
Yeah.
But I think everyone should do that if they can afford to.
Yeah.
It's always good to know more about your own body and your genetic risk. And even from my own 23andMe report, I know my elevated health risk genetically.
Yeah. Interesting.
Which is helpful.
Yeah.
Yeah.
So yeah, interesting, right? Super interesting.
And they probably had to fight really hard to be able to publish these health risks to not, anger the FDA.
Yeah.
by giving irrelevant.
It's a bit of a fine line, right? The regulatory line is a bit of a.
Exactly, which is why, even though unfortunately they are going through this bankruptcy, I would say they really were the first movers in this consumer genetic testing or health monitoring space to be able to give these health insights that are really important. But when you give such important health insights, obviously FDA is going to get involved. So
so you said they were FDA approved, right?
In 2015, it was for the breast cancer related genes.
Of course.
So they were saying like we can detect the exact variant, like the BRCA. Yeah. Not all variants, but like certain variants that are known to definitely increase the risk of breast cancer. So they had to fight with FDA to publish that.
So what do they get to say about those genes, the FDA approved genes, that they are not allowed to say about other genes?
I haven't followed them since this, but they just want to say like you do actually have a elevated risk of breast cancer, but I don't know if they followed the same processes, because like a lot of it depends on how you frame it, the information. Are you framing it as like you definitely have a 50% higher chance
Yeah.
of having breast cancer? Or are you saying like you just have a slightly elevated risk of this disease?
Depends on the wording and the framing.
Yeah, exactly. Yeah, that's a great question. I haven't been updated yet, but
Okay.
I just know like 2015 was like the iconic approval.
Yeah.
Yeah. Anyways, moving on.
Okay. Here we go.
Sam, what's the second deal from May 2025?
So this is a big and exciting deal where Pfizer is paying $1.25 billion upfront with a potential total of $4.8 billion.
That's 6 billion total.
Sorry, $4.8 billion further dollars. I always get it wrong. $6 billion total dollars.
Yeah.
For the ex-China development of a bispecific antibody. So they get the rights to develop this antibody everywhere in the world apart from China. And then they keep
the rights. The company keeps the rights to do it in China.
Exactly. Yeah. So the 3S Bio is the company that have the rights in China, and Pfizer will now get the ex-China rights for the rest of the world. And the antibody is a very exciting antibody called a PD-1 VEGF bispecific.
And just as a background, what is the bispecific antibody?
Yes. So if you listen to our first episode, so
let's assume they haven't.
What it is? It's an antibody which targets two things at the same time. So the PD-1 antibody, what it does is it binds and it blocks PD-1. PD-1 is something that cancers use to protect themselves from the immune system. So if you block PD-1, then if you block PD-1, then you can reactivate the T cells to kill the cancer cells. But it's a bispecific, means it binds PD-1, but it also binds something called VEGF.
What's VEGF?
So VEGF is something that cancer cells use so that cancer cells get hypoxic, right? And you're the expert in this. You tell us. You've got a PhD in hypoxia.
So VEGF is a very famous angiogenesis factor, and is often expressed by hypoxic cells. Because when your tumor cells are deprived of oxygen, which happens quite often because your cells are growing uncontrollably and they're consuming oxygen faster than the blood vessels can supply oxygen, the cancer cells are very smart, and they use this natural mechanism in the cells to express more VEGF to create more blood vessels, a process called angiogenesis. And when they do that, the cancer cells can escape through these new blood vessels and metastasize. So yeah, like a really noteworthy target for these therapies. So to prevent metastases.
Indeed, but and so if we block VEGF, we can block that mechanism. But it turns out that if you block VEGF, you also, and it's slightly slightly counterintuitive, at least to me. If you actually block VEGF, then the tumor microenvironment gets better blood supply. So the vessels produced by VEGF are not very good vessels. They're kind of leaky vessels. They're a bit
chaotic.
Cruddy. They're very chaotic. So if you block VEGF, then you actually make kind of better vessels that reoxygenate the tumor microenvironment. And that means that T cells are happier and they infiltrate better. And so it synergizes with PD-1 inhibition. That's why if we add them in the same molecule, the PD-1 and VEGF blockers in the same molecule, it kind of synergizes, and the VEGF blocking makes the PD-1 blocking better.
Sam, that's a beautiful explanation. You do want the normal vasculature to be there. So then your helpful immune cells, like your T cells, can get to the tumor.
Exactly.
Yeah.
Exactly.
So that's exactly, there's the good vasculature and the bad chaotic tumor promoting vasculature, and you're blocking the bad tumor promoting vasculature.
And it seemed on first glance, it seems like PD-1 and VEGF are just two random molecules. Let's just hit them both at the same time. Why not? But it's not like that. It's actually, they are converging on the same pathway. And that's why it's, and sorry, were you going to say something?
No.
So this is, do you know what the biggest selling drug in the world was last year?
Keytruda.
Yes. Do you know what the biggest selling drug in the world was 2 years ago?
What was it?
Keytruda.
Oh, right. I was like, is this a trick question?
It's not. So Keytruda is
testing my biotechnology.
Keytruda is the PD-1 antibody, right? So
Blockbuster drug.
biggest blockbuster drug in the world. So the big massive wave of PD-1 antibody, but now it turns out we've got a PD-1 and VEGF antibody, and to be honest, I think what's going to happen is that we're going to see Keytruda, PD-1 antibody on its own, get taken over.
You think so?
And that's supported by the data. So there's a big trial from this year, phase 3, big trial in non-small cell lung cancer. So it's very immunogenic because it's usually smokers, so there's lots of mutations, and it responds well to immunotherapy. So PD-1 blocking immunotherapy. But it turns out that if you use a PD-1 VEGF bispecific, it beats the PD-1 the PD-1
I didn't know that.
monotherapy on its own. It's better.
Wow.
But the issue...
No wonder there's so much excitement about these types of deals.
Exactly. The issue is that if the bispecific can beat PD-1 in lung cancer, then it's probably also going to beat it in colorectal cancer and liver cancer and so on and so forth.
It's the same logic.
It's the same logic. So we might see Keytruda get toppled.
That's why these deals are so big. And, this is, there's this trend as well. It's interesting politically and scientifically. Because, with the current political climate and the trade tensions between China and the States, it's cool to see that these pharma deals are still going forward. Like the one between Pfizer and 3S Bio that you're talking about, but also Merck paid around half the amount last year for another licensing deal with China biotech. And now Pfizer's paying even more.
Was that for a bispecific as well? Was that for...
I think it was for a bispecific as well. So there's more licensing deals between China and the States, and it's good because China, the China biotechs get to keep their rights to sell the drug in China,
right? And
the U.S. gets the right. The U.S. companies get the right to sell the drugs in the U.S.
It's interesting, right? It's nice.
So it's a win-win still, despite the tariffs.
Yeah. The other thing about I always find our approach to cancer very simplistic. Right. So when we do PD-1 blocking, we just think there's one protein, let's block it. Right. But now this is a little bit in the right direction because now we think, okay, let's got 2 proteins, let's block 2. But if we can do 2, why not more than 2?
Why not do 2? Why not do 3 or 4 or 5?
Exactly. So I wondered actually what the most blockers we can add to one molecule is.
I think on paper that's an amazing idea. And yeah, just for the audience, these bispecifics, they have a linker. So there's a linker, and then you've got the 2 antibodies, and each antibody targets their own target protein. Yeah. But the problem with, like, in my head, maybe I'm more of a skeptic in this case. If you have a tri-specific or quad-specific, then there's a lot of hindrance. It's hard to bring in all these targets together. Otherwise, I think it is a great idea on paper.
I agree. Yeah. I mean, from a chemistry perspective, I don't really know, but so I tried to find what's the most blockers we can add to one molecule, and what I could find was there's a penta-specific. So it inhibits.
That is mad.
I'm going to tell you the names of the proteins it inhibits all at the same time, right? HER2, IGF-1R, CXCR4. I'll be honest, I don't know what that is. EGFR and VEGF, all in the same.
All the famous ones, basically.
Yeah. Plus, do you know what CXCR4 is?
I think it's this immune thing. I might be wrong.
Oh, okay.
Yeah.
Okay. Yeah.
I might be really wrong, but yeah, the other ones are famous tumor drivers.
Exactly. Why not hit them all at the same time? I like that.
Makes sense. I mean, it's ambitious, but why not try?
Yeah.
Yeah. It's just a chemistry nightmare of a puzzle to figure out. But
for sure.
Aside from that.
And I feel like when I talk about these things, you can tell I'm not a chemist. Because I'm
not a chemist either.
I'm saying mad things that don't make any chemical sense.
I've just worked with chemists who complain about how hard it is.
Yeah,
to make
I'm sure.
Bispecifics.
The other thing is that I think it would be fair to say that Pfizer are a little bit late to the party.
Yeah.
On this, so they've paid $6 billion.
Yeah,
total, and
exactly.
they are late to the party.
Do you think they've paid more because they're late to the party?
Yes.
And just to say this, for this drug, they want to begin phase 3 trials in China this year, and it's interesting to see that for this bispecific.
For which cancer?
I think it's for colorectal, non-small cell lung cancer, and ovarian.
Okay. The lung cancer trial is already out, but
we're still waiting on the other two then. But yeah, I was going to say it's interesting that these trials are all happening in China for these US-China deals because people are saying that all the trials are being outsourced to China where it's cheaper and faster to get the data rather than doing it in the States. I think it's an interesting trend.
That is interesting. But in order to get regulatory approval in the States, they will still have to do the trial in the States. I guess you can get the signal from China, but because the populations are quite different, right? So just because it works in the Chinese population does not mean it necessarily is going to work in the US population, right?
I'm thinking you still need to do a trial in the US.
They would definitely have to do a confirmatory trial for the FDA. But still, it's always good to have some signal. If it doesn't work in the Chinese population, then maybe they will be like, we won't worry about it.
We won't bother then. Yeah, exactly. And it's cheaper and faster to do it first there. So, yeah, before you spend more money on the US trial.
Yeah, exactly. So
thanks, Sam. That's an exciting deal.
Fascinating. I'm going to see Keytruda toppled. You know what the second biggest selling drug in the world was last year?
Oh gosh, is it a GLP-1 drug?
Yes.
There you go.
It's Ozempic.
There you go. I bet you it's gonna overtake Keytruda.
Ozempic, you think so? Yeah, I wouldn't be surprised. I wouldn't be surprised.
That's my bet. Anything else about that deal?
No, I don't think so.
Cool. Well, it's the age of bispecifics.
Yeah, or maybe we get pentaspecifics.
You heard it here first. Sam's bet on pentaspecific.
Yeah, let's buy the stock.
Yeah. What's the company making the pentaspecific?
I would have to check. There you go. Zybodies.
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 Interesting name. Cool. All right. Last deal. Pivoting a bit.
Pivoting.
We're moving into the RNA world. So this is a deal between Eli Lilly and this South Korean biotech company called Rznomics.
I love the name, right?
Or Rznomics if you're a Brit.
I can't pronounce it at all.
Me neither. I'm probably butchering it as usual. And it's for a $1.3 billion deal. They don't disclose how much is upfront versus milestone payments. But it's for treating hearing loss and the most common cause of hearing loss, which is a sensory neuro hearing loss. And you probably know more about this, Sam, but it's when your cochlea loses its function through maybe hair loss or damage from like listening to music too loud on your AirPods or oxidative stress, inflammation.
That's definitely going to happen to me, the AirPod one.
Do you listen to your music on max?
No, I don't. I turned it down, right?
I remember you like to turn it down.
Oh, I always turn it down. Maximum half volume. Yeah, even though it's way funner if it's louder, but...
No, you're sensible.
Yeah.
Hopefully you won't need their therapy. But yeah, it's addressing an interesting trend in the RNA world where lots of companies are now in the RNA space because they understand more about RNA. And this company, Rznomics, they've got a trans-splicing ribosome platform. Basically, they have this molecular machinery that can go to a faulty transcript, RNA transcript, and either destroy it or replace it, splice it and replace it with the correct copy. You just like splice out the bit that's wrong and then like ligate the part that's correct and then let that get translated. So that's really interesting. And you can see that being used in different diseases.
Super smart, right? So like we said last time, we were talking about how to fix genetic diseases. And we were talking about how one option would be to simply, so in this case, you could, so what they're really focused on is genetic causes of hearing loss, like monogenic causes of hearing loss. And one way to do it would be to just give back the gene, right? Just put back the wild type gene and fix the problem. And that's doable, but then you, like we said last time, you then have to put in your exogenous promoter, your exogenous regulatory machinery, which means that you lose the patient's own native machinery, which does a much better job of keeping the gene at the right expression.
Yeah.
So if you can do that, but if you just fix the RNA, then you leave all of that regulatory machinery intact, which means that the expression of the gene, which is what's really important, is under normal control, healthy control, and that's why it's such a good idea.
Exactly. And for the interesting bit about this, you mentioned, because like it could be, because there's aging related hearing loss, and then there's also the genetic causes. So this could technically address both, but it's easier for them to look at the mutations that are associated with hearing loss, and then just replace those mutated transcripts with the correct copy. And that's exactly what I think they're trying to do. They don't disclose any targets, but
no, it's not. It's not clear, is it? What they're shooting for?
It's not clear. But inside the company itself, they do have a lead candidate for an RNA replacement enzyme-based gene therapy for liver and brain cancer.
And this is fascinating.
Yeah. And, Eli Lilly, they're really focused on the RNA, DNA space now, because they've also recently, I don't know if you've read about this, but they bought another RNA therapy company called Crayon Bio. And that's for AI design. Of course, you need AI. Oligonucleotide therapies. And oligonucleotides are just short strands of DNA or RNA that can restore or modulate RNA expression. Yeah,
super interesting. And it's interesting that they're not going to call it mRNA, by the way, because if they call it, because mRNA has become, for whatever bizarre reason, a toxic phrase.
Really? You think so?
Yeah, completely toxic. So because people, well, I don't know why, but it's totally become toxic. So they're not going to call it mRNA, they call it RNA.
Because it's synonymous with COVID vaccines.
Yeah.
Wow.
And the anti-vax crowd would jump on this and say mRNA, this and that. So they call it RNA, which is much smarter.
This is so interesting. I never thought about that as a scientist, but I guess as like a layperson, you'll be like, oh, it sounds like a vaccine.
Yeah. I think we talked about this before, right? Because like, if you have, I've seen papers or new discoveries that will report a vaccine, and they won't call it a vaccine because vaccine, again, for a proportion of the population, has become toxic. So they'll call it like an immunotherapy or a...
Which it is.
They'll call it essentially some euphemism of vaccine because they don't want to use the word vaccine. They definitely don't want to use the word mRNA.
Yeah.
Because it'll inflame a subset of people. So it's an interesting, like from a communications perspective, what do you call the therapy, right?
Yeah,
they would never call it mRNA.
That's so interesting. I never thought about it that way. But yeah, you're right. So now they call it
so
oligonucleotide.
Oligonucleotide.
There you go.
Right? What does that mean? Doesn't mean anything.
It doesn't.
It's perfect.
For them, the general public, that has nothing to do with mRNA. But for us, we're just like,
it's the same
that
thing.
could easily be the same thing.
Oh, it's exactly the same thing. But no, exactly. So that from a comms perspective, that's really interesting.
Yeah.
How do you communicate your new things when something has become so toxic?
Yeah, you want to pick like the good parts of it because like I guess RNA does sound exciting to a subset of people.
To me, it's exciting.
Yeah, to me, it's exciting.
To lots of people, it's toxic.
Oh gosh, maybe we're not our little echo chamber.
Yeah.
But Eli Lilly, they've also just saying they're really going all in on this like DNA RNA strategy because they opened last year a $700 million R&D center in Boston to focus on DNA and RNA facilities.
Awesome.
Yeah.
You mentioned the lead compound in HCC, liver cancer, hepatocellular carcinoma. And it is fascinating, right? So it is essentially, it's using the same platform, the same idea for the hearing loss, but it's for liver cancer. So what it does is it's tricking the liver cancer into killing themselves. It's tricking the liver cancers into suicide.
You should tell us more about it. I actually didn't read into their liver compound.
So the way it works, lots of liver cancers express telomerase. So what their approach, and telomerase extends telomeres and stops the liver cancer dying and allows it to keep proliferating.
The caps it's like the cap of the DNA.
Exactly. Yeah. So it stops oncogene-induced senescence. Oncogene-induced? It stops senescence because of short telomeres.
Senescence being like the cells hibernating, basically.
Yes.
Yeah.
So the cancer tries to produce telomerase, but what these guys do is they come in and they change an exon to change the telomerase into a suicide gene. So when the cancer tries to produce telomerase, it doesn't produce telomerase. It produces a suicide gene.
That's so cool.
and it kills itself.
Well, like an apoptotic gene, or
Yes, no, that's right, exactly. So
you love apoptosis, obviously, from your PhD.
Yeah. And it's interesting that the liver, you'll notice a lot of these kind of new innovative strategies all target the liver and liver cancer as well.
Yeah.
And so you'll get things like the gene therapy we talked about last time. You get this RNA therapy. You get things like oncolytic viruses, all targeting the liver for good reason. It's a good vessel. It takes things up easily. It's easily found. It's got a great blood supply.
Yeah.
So all of the new, well, maybe not all, but a lot of the new, most emerging therapies will target the liver, which is interesting.
That makes sense. That's because it's like low hanging fruit, and for the reasons that you listed.
Yeah, and you can, so their therapy actually, to be honest, you actually have to inject it directly into the tumor. So, which is a bit horrible because you have to go through the skin and actually inject it into the tumor, which is a clear flaw. But you can't just, for pancreas, for example, you can't just inject something into the pancreas.
No.
But the liver's kind of right there. You can even feel it under the skin. So it's easily accessible as well for these kind of super innovative strategies.
Yeah, you can't just IV it like in some sort of vector. Do you think you can encompass it in like an AAV or something?
You can. Yeah, and it will take up, one of the things that it does is it takes up things like that, like the viruses, super easily.
Yeah.
I guess there's a lot of reasons that it's such a good kind of vessel for these innovative strategies.
Yeah, it's a good proof of concept indication to go into.
Yeah, exactly.
So exciting. I love RNA. Even though I love proteins, I love RNAs as well.
RNA is very interesting.
Yeah, I think we're just starting to break into the non-coding and RNA world properly. Yeah.
Like your conference, right?
Yes, and dark genome, there you go. It's not junk DNA, guys. Cool.
Good.
Thanks,
That was
Sam.
exciting.
Yeah.
So we talked about.
Yeah. Would you like to summarize?
You summarize.
I do it.
Yeah.
Okay, fine. So today we talked about, firstly, the top 3 deals in the biotech world from May 2025. The first one being 23andMe going bankrupt. The court hearings are still ongoing, but it's planned that Regeneron, the big pharma, will buy them out for $256 million. And the second case is Pfizer signing a deal with Chinese biotech called 3S Bio for around a $6 billion deal for their bispecific against PD-1 and VEGF. But they're late to the party, as Sam has said. Let's see if they can catch up.
You're paying an extra few billion for being late to the party.
Yes, just to get them to hurry up a little bit. And the third and final deal is Eli Lilly buying an RNA technology platform from South Korean company called Rznomics or Rznomics for a $1.3 billion deal in hearing loss. So yeah, an exciting May. But just to say, one last comment is, I don't think there has been a biotech IPO in the past 3 months. Just to say that the funding landscape and the economy is reflected in the number of IPOs.
Interesting. Wait, so what is typical? How many would you expect in a 3 month?
More than that, I think. I think when you've gone 3 months without an IPO in biotech, it's a sign.
Is it? Oh, interesting.
Yeah. But as we all know, it's a bit all economically uncertain right now. So
yeah,
can't say I'm surprised about this.
Interesting. What was do you know what the last one was, or like a recent IPO?
I don't remember. The last biotech IPO. Sometime in late Feb, early March. Advanced Biomed. Yeah. And then the one before that was late 2024. Yeah, not too many. So hopefully the economy recovers soon.
Yes, hopefully. We'll see.
It just shows that there's not enough funding to go public.
Yeah.
Yeah.
Okay.
So
Good. That was a good
thank you, Sam. I'll see you after my travels.
Yes, enjoy. Tell me about the conference and the funding and everything else.
And you can catch me up on what's happened in June.
Yes.
Halfway through the year.
Oh my God. Sped by.
Yeah, and hopefully next time we get sunlight, more sunlight than this, even.
Yeah.
Because it'll be summertime.
Yeah, good.
Yeah.
Okay.
All right. Thank you.
Nice to see you. Bye-bye.